Hello you guys, so this is going to be my septoplasty vlog. I don't know about you guys, but whenever I have to go in for surgery, I am neurotically researching the whole process, the recovery. I'm watching other people's vlogs, I'm reading forums, I'm joining Facebook groups. My surgery's on Friday, and so far I have talked to the surgical coordinator, and I've also talked to the anesthesiologist, and let me give you guys a little bit of information on what that phone call with the anesthesiologist was like, because for those of you who aren't familiar, going under anesthesia is a very intense experience. I think it's always good to have an anesthesiologist check in with you and get a thorough history of the medications that you're taking, your allergies, and perhaps the past experiences you've had with anesthesia. I have been under anesthesia 3 times now, and the first time I went under anesthesia, it was not a great experience. I woke up extremely nauseous. I pretty much woke up and immediately started throwing up. And then I was throwing up consistently for the next hour after waking up for my surgery, just literally projectile vomiting, and I had nothing in my stomach, so I was literally just vomiting stomach bile. On top of that, I had abdomen surgery, so it didn't feel good for me to be vomiting consistently on top of having incisions all over my abdomen. Honestly, what's crazy about this is that first anesthesiologist that I had warned me before he put me under that me being Asian would make me susceptible to nausea because of anesthesia. I don't remember if he explained that to me. I don't know if it's our genetics or something within our bodies that doesn't digest or respond well to anesthesia, but he warned me before putting me under that I probably will wake up extremely nauseous. So I guess I'm thankful that he gave me a heads up, and he was right. So I made a really big effort after that with my other surgeries to tell my anesthesiologist about that experience and how nauseous I was. I don't know what they do differently, but ever since then, I haven't had that experience of becoming nauseous from anesthesia. I actually didn't know that I had a deviated septum until I went to the ENT over a year ago. And I only went to the ENT because of the jaw issues that I was having. Long story short, what ended up happening is the ENT during my checkup with him told me that I had a really bad deviated septum. And that was my first time hearing about it. And it was such a surprise because I didn't even go into his office to talk about the nose breathing issue. I didn't even know I had issues breathing through my nose. And so when he told me that I had a deviated septum and that it was a pretty bad one, because I think there's 3 classes of deviated septum, and mine had an S-shaped deviation, which means that I could barely breathe out of that nostril. And he even used this tool to stick up my nose and prop up my nose in a certain direction. And he had me try breathing before that and after, just to see the difference of what a normal airway is supposed to feel like. And when he did that, I was so shook, because the thing about always having these health issues is that you don't know anything other than what you've experienced your whole life, right? And so when I got to experience for a moment what it's supposed to feel like to breathe through your nose, I was just like, holy shit, this is probably why I have so many health issues. So I'm about to show you guys what my deviated septum looks like. If you feel squeamish about looking up someone's nose, I suggest that you fast forward to this timestamp of the video. But if you are like me and you are curious as to what a deviated septum looks like, I am about to show you what my deviated septum looked like from the inside. Also, pardon my congested voice. I'm still very much so recovering from surgery, and there's still a lot of congestion going on as I'm filming this video and recording this voiceover. So what I'm showing you guys here right now is the right side of my nostril, which is where my deviated septum is. As you can see, there is this reddish looking flesh in the back of my nose hole that's blocking almost the entirety of my nose hole. That is where the deviation is happening. That's not supposed to be there.
Here in a second, I am actually going to show you the left side of my nostril where there is no deviated septum, just to show you guys what a generally normal nose hole is supposed to look like. As you can see, it's a lot darker when you look up into the nose hole. There's not that red flesh covering half the nostril. And then I'm actually going to flash back to my deviated septum just to show you how much of a difference it makes to have that deviated septum covering almost more than half of my nostril.
It's day of surgery. My surgery actually got pushed back a few hours. Originally, I was supposed to check in at, I think, 6 a.m. But now I'm gonna check in at 9:45, which thank God, because I hate waking up early. It just makes me so anxious. I'm good at it, but it makes my nervous system so dysregulated. So I woke up at 8 a.m. this morning, just took a shower, just in case I won't have it in me to shower for the next day or two, and got dressed in my surgery outfit, which is just basically all my comfiest clothes, all black too, just in case I stain my clothes for whatever reason with blood or other things and I don't have to worry about it. I try not to wear too much on surgery days, and I wear things that are easy to put on, just because when you wake up from anesthesia, the last thing you want to think about is putting on like tight pants or like a tight shirt and things like that. But I'm about to help my partner make some coffee as he's getting ready and walking the dogs. I had stopped drinking and eating since last night at 12. This happened to me last time I had surgery. I just got like super thirsty. I drink a lot of water, so right now I could feel the need to like go drink water, but I'm not allowed to. And I forgot to add as well that when I stick my finger up my nose through my deviated septum, I can't actually stick it in all the way because of the deviation. So this one I could stick up and go as far as I want to. This one, it stops like right here because I could feel that bone just covering the whole nose hole. So it's really weird that I'm not going to feel that anymore after today. I'm excited. Let's do this. I was anxious all day yesterday. Just could not relax just thinking about this. I've just been telling myself and my partner, I'm going to the hospital to take a really long nap. That's it. I'm not getting surgery, just a long nap. I'm gonna go there, fall asleep, wake up, and then everything's gonna be fine. But yeah. I got the wrong filter size, so it's super small and I have to be really careful. Gotta make sure all the grinds get mixed in there. These are a list of things that I request from my partner, or just request in general, in my post-op recovery. I'm a very simple woman. Now, checking on the sandwich I'm heating up for him. Some Jimmy Dean. That stuff is so good. So this is day 2 of recovery from the septoplasty. Not gonna lie to you guys, it's been rough. That's something I've been noticing with myself, is that whenever I get surgery for something that I think is standard, because hella people do it and they get through it fine, that I would have the same experiences, and that has not been the case. Like, my wisdom teeth recovery has been horrible. It was so bad, and yesterday coming back from the hospital, I just was essentially having a panic attack the whole time, which was not fun. I hadn't felt like that in a while, to be honest. Like, that feeling of like, I don't know if I could go through this, I want to die. Like, I know it sounds really dramatic saying that out loud for you guys who might not be going through that sort of discomfort and pain, and even sitting here now, I think it's dramatic for me to have genuinely thought that in the moment. But man, I was just laying on the couch in so much discomfort and couldn't breathe, which was so scary. And I, even after having panic attacks, begged my partner to go bring me to the emergency room because I didn't know if I could make it through the night. And he, since he's a nurse, he put his watch on me that keeps track of all of your information, and he showed me that my oxygen levels were fairly normal. It was fluctuating anywhere between 93 to 98, but it didn't feel like I could breathe because the only way I could breathe is through my throat, and my throat was hurting a lot from the tube that they shove into your throat during surgery. Obviously can't breathe through my nose. It's already hard for me to breathe through my throat because of my recessed jaw. So every time I would fall asleep, my jaw would recess, close off my airways, and then I would start nose breathing, which I can't do because of the splints in there and the congestion. Like, you could hear it. Basically didn't really get good sleep at all. I feel like discomforts and daily comforts for me is harder to tolerate than actual pain. Because recovering from endo, I was still able to eat, I was still able to breathe fairly normally. So just the pain in the abdomen and pain in your undercarriage area, like, I could deal with that, you know, that's fine. But as soon as I can't eat, can't taste, can't breathe, I feel like I'm gonna die, you know? I think that's where I'm at right now. Poor sleep, panic attacks, can't breathe. Hopefully it'll get better day by day, so we'll see. I don't know if you guys could tell or not, but my nose is swollen and my nose holes are really big because he put these huge stents in my nose that are like this big on both sides. Been getting a lot of blood clots coming out of my nose or my throat, depending on where it's sliding. A lot of crusted blood in my nose holes, which I've actually had a fun time picking because I have picking issues with my hair and scabs and skin and everything. So I will check in with you guys tomorrow on day 3. Day 3 update. Super, super, super congested. Like, that's how congested I am. I straight up sound like Donald Duck. Sleep has been rough ever since getting surgery. I think that's probably the hardest part overall of recovering from the septoplasty, is being able to fall asleep and stay asleep, because most people are probably used to breathing out of their nose during sleep, and you would think that your body knows how to just switch to mouth breathing when it has no access to nose breathing, but that's not been the case, because every time I fall asleep, I'll start breathing through my nose instead of my mouth automatically, and then I'll wake up because I'm basically not getting any oxygen into my body, breathing through my nose. And so it's just been like, you fall asleep for a few minutes and then you wake up immediately from breathing through your nose, which is basically all plugged up. And breathing through your mouth is difficult too, because one, it's super, super dry. The feeling that my throat has right now is like a really bad sore throat combined with cotton mouth. So it's really bad, because sometimes when you have a sore throat, you won't have cotton mouth that goes alongside with it. But imagine having the worst cotton mouth in the world, where your tongue feels like it could get plastered to any part of your mouth and then it just sticks because of how dry it is.
there's that in combination with the really sore throat from the breathing tube being shoved down your throat. That one's been like unexpectedly difficult for me. I will say as well, the pain in my nose has been worse today too, and I have really high pain tolerance. It's been pretty sore. It kind of feels like, if any of you have ever been scratched by a cat, it feels like you got a cat scratch on the inside of your nose. Or if any of you have had tattoos, you know when you're recovering from getting a fresh tattoo, it feels really tender and all of that kind of stuff. That's basically what the inside of my nose feels like at the moment. My surgeon actually didn't really give me many instructions on aftercare, but I've been trying to maintain my hygiene as much as possible, so I've been pretty neurotic about brushing my teeth. I'm also neurotic because I have braces, so I really don't want to like have gross, dirty teeth and bad breath on top of feeling the way that I do. I'm just being careful as I rub my sunscreen on my nose because my nose is tender. Yeah, so I've been brushing my teeth and using my water pick 3 times a day, basically after I eat, just because I'm in and out of sleep, and the worst feeling for me is falling asleep. You hear how stuffed my nose is, like it keeps quacking every single time I'm talking, but the worst thing is while you're recovering from surgery and you're falling in and out of sleep after you eat, it doesn't feel good when you wake up and your breath just smells rank and you could feel the bits of food in your braces. I took a shower on day 2. My hair is clean right now. Taking a shower wasn't difficult. Honestly, moving around hasn't really been difficult. It's just the sleeping aspect of it, the breathing aspect of it, the dry mouth, all of that kind of stuff. Oh, another aspect of recovering from surgery, for those of you who may not know, is you are super constipated coming out of surgery. Usually you won't have your first poo, like your first bowel movement, until a week later. So that's where I'm at right now. You could try to take like laxatives, stool softener, or Miralax, but in my experience, those things don't really work for me. Maybe I just don't know how to keep track of whether or not it works, but I'm just hoping that I could have a bowel movement here within the next few days. I'm gonna will it into existence. I didn't eat the whole first day because I couldn't bring myself to eat. That's the other difficult part of all of this that I don't see people talking about, and that is that because your nose is so stuffed, you can only breathe through your mouth. And your mouth and yours is so dry, your throat is sore, but on top of it, when you're eating, it's difficult to swallow and it's difficult to breathe because while you're chewing and swallowing, you can't breathe through your nose. So you see where the issue comes in. Because that first day was so overwhelming for me, I didn't eat that whole day. I was just trying to focus on breathing through my mouth because it's almost like I didn't know how to breathe through my mouth. Second day, I started eating again. I started off with smoothies and putting as much nutritional value in there. So like a banana, oat milk, a bunch of walnuts, prunes, hemp seeds, kefir, or kefir, however you pronounce it, just making sure I got like a good amount of nutrients in there just because I can't really chew very well right now. It's easier for me to just drink, swallow, breathe, drink, swallow, breathe, instead of take a bite, chew, breathing as much air as you can while you're chewing and then swallowing. It's just a lot, right? But with the type of painkillers that I've been prescribed and the antibiotics, I have to eat food. So I've just been eating little bits here and there, drinking a lot of smoothies with prunes in it, trying to get that bowel movement coming. right, so today is day 4 of post-op septoplasty. My throat feels a little bit better. I started taking cough drops yesterday, which I think helped, because it straight up felt like a sore throat. It was so bad. I say all in all, day 3 was the most pain that I felt in my nose. And today I woke up and I ate breakfast, which I'm thankful for. It's been really different because I think starting day 2 onwards, I started being able to eat again. And I started having, I think, my first bowel movement the 3rd day. And then the 4th day, I started getting more bowel movements. And it's not like all of it at once. It's just like little bits and pieces. I think eating more helps because it pushes what's in there out. It's weird because I don't have my sense of taste, so I'm just kind of taking advantage of that by eating whatever I think is good for me rather than what I crave, which is usually how I tend to eat. The other day I mixed cottage cheese with eggs just to give myself extra protein. I've been making myself a lot of smoothies, like I said, because I really don't like chewing when there's all this stuff going on. So drinking my nutrients has been helpful. The only things I could really taste at this point, and it's not even like a taste, it's just I could identify how it makes my tongue feels, if that makes sense, is super vinegary things. So sauerkraut, kimchi. I've been pretty consistent with walks too, just because I've been getting really restless laying on the couch all day for days. It's so weird because usually when I'm in burnout, I could do that even when I'm not supposed to, but ironically, now that I am supposed to just rest and recover, my body's like, I want to go move. But I've been getting the restless leg syndrome. For those of you who have experienced it before, it's like you're laying there and your legs just almost feel like they're on fire because it needs to move so bad. And you get this, well, at least for me, I get this really intense adrenaline rush and I feel the need to like go run a mile, but I haven't been able to because I'm not supposed to exercise at this point. I will say day 3 and 4, the splints are hurting my nose. Like, it feels pretty scabbed up in there. For those of you who have ever healed from a really intense tattoo session where the needle went in really deep and caused a lot of damage, for example, I had that recovery for this piece here. The scabs that form after the fact are so thick that it's like pulling all of the surrounding skin in towards the scab because it's so tight and it's so tender underneath. It's almost like the skin isn't healing underneath the scab as fast as it needs to. And that tenderness of like, if you were to touch on that really thick scab, that's how it feels inside my nose. If you guys could kind of like follow along my explanation. But yeah, 2 days until I could get these splints out, and I'm gonna try my hardest to get that in a video for you guys because it looks gnarly, and I'm gonna be so happy when they're out because hopefully I could smell again and hopefully I could taste again, and my life has not been the same since not being able to taste food. It's been rough. But yeah, day 4, today's a Monday. I took today off work. I'm gonna take tomorrow off work too, just to give myself some time to recover and not have to sit at my desk and work. I spent yesterday watching 𝗪𝐺𝐺 Kaisen Season 2 on Crunchyroll, and what I have on my roster today is to cook a recipe that I found on TikTok and eat it even though I can't taste it, and watch some movies. I want to watch Aquamarine, so that's what's on my roster today. Okay, so it is day 5, Tuesday. I am going to get my splints out tomorrow. A little bit of an update. The congestion got a little bit better. Granted, I think that leftover congestion is mostly from the splints that are in my nose. Pain-wise, I feel like the soreness and tenderness has gone down a lot by this day. The only thing is that it feels... I keep comparing it to scabs because that's how it feels, and that's what it kind of is. Like, if you were to touch it, like, I'm touching the inside of my nose where the incisions probably were, and I could full on touch it and like feel around the plastics and stuff like that. It's just a little bit tender. It's kind of like when the scab is near the end of its healing process and you could either let it fall off on its own or peel it off. And if you decide to peel off the scab, the skin underneath is new enough where it could feel a little bit sensitive if you were to poke it. That's my comparison. I've actually been enjoying not being able to taste somewhat, not because I don't mind it, but because I've been making use of this time where I can't taste to eat really healthy food that's good for me because I can't taste it. Just to see how it makes my body feel. Like, I woke up this morning and I went out of my way to make a well-rounded breakfast. I made myself an egg, avocado, and oatmeal, healthy fats and proteins and fiber, just to start my day out right with like the right type of nutrition and see how I felt. And hopefully when my taste returns, I could carry over this habit forming into, maybe it's not realistic to say every day type of a thing, but like at least once a week maybe I like make a healthy breakfast and whatnot. I think a part of not being able to taste too is I don't binge eat as much, so I pretty much just eat until I'm full, and I turn out to only eat a fourth of what I usually eat because I have a tendency, due to my neurodivergence, ADHD and autism, I could tend to overeat sometimes because I get so focused on the taste of the food, and it's like a stim for me that I, even if I'm full, keep eating and eating because it feels so good. And then by the time I stop, it's like I'm way past the level of fullness that I can handle.
Alrighty, friends. I am about to show you my nasal splints being removed. So if you guys are disgusted by snot or blood, perhaps do not watch this part of the video because there is going to be a lot of snot and some blood. Skip to this timestamp if that stuff makes you queasy. But other than that, if you are sick like me and you find some sort of satisfaction in things being removed from people's body, whether that's popping a pimple or cyst or pulling nasal splints out of someone's nose holes, then enjoy yourself and keep watching. The splint removal actually didn't hurt. It just felt slightly uncomfortable because they are so big, so it kind of stretches your nose hole as they're being pulled out. But if your doctor does their job well, they will make sure that all the stitches are going to be cut first, so that when they do go and pull the splints out, it's not going to tug on your nose if they did miss a stitch. My doctor did warn me that cutting my stitches would hurt, but for some reason, it didn't hurt me. I think everyone just has a very subjective experience with pain. Immediately, I could feel all of that cold, crisp, fresh air going in through my nose holes. It just feels so great to be able to breathe through my nose again and smell everything again. All right, so it's been 1 week post-op already. First of all, I want to answer the question of, was it worth it? It's really hard for me to just say yes or no a lot of the times because the thing is, I have to understand what the other person is looking for, you know? Sometimes all someone cares about is whether or not the relief of symptoms after is worth it. And sometimes for other people, because of their unique circumstances, the process it takes to get to the point of relief of symptoms, if that is too difficult, maybe that's not worth it, you know, things like that. So I'm going to try to answer this as honestly as I can. The relief of symptoms is astronomical, and I will go into what it feels like and why it's astronomical. But I will say the recovery process after the surgery was so much more difficult than I thought it would be. And you know how there's people that will very quickly say, oh my God, recovery from surgery was so difficult. It was so painful, but I would do it all over again. I feel like for me, I would not be able to go back and say yes to the surgery because of how hard it was for me during the recovery process. Coming back from surgery the day of, that was one of the hardest nights I've ever been through, emotionally, mentally, and physically. Going into it, I had thought that it would be a standard surgery because so many people have got it done. You hear all the time people getting their deviated septum fixed and things like that. If you search on YouTube, people's surgery experience and recovery experience, you could find so many vlogs. And coming from the experience of getting endometriosis surgery, I thought that a surgery that unique and not as widely performed, because I was able to get through that recovery pretty well, that it would automatically translate to this recovery being easy. The thing is, it's hard to quantify pain in recovery when it comes to your body because the sensations and what your body is going to go through when it comes to getting something in your nose fixed is going to be different than getting, let's say, your abdomen worked on and things like that. And it's important to keep that in mind, right? So it's easier for me to lay in bed and my abdomen in pain than it is for me to not be able to breathe out of my nose for a week, losing sleep on top of it, not being able to taste and draw comfort from food. You know, those things take a really, really big toll on me. And I would rather go through more physical pain than to go through all of those very specific discomforts. Because the pain itself in recovery is not bad. I was basically only on ibuprofen and Tylenol, even though I was prescribed oxycodone, but I didn't take the oxy because I'm scared of pain medication like that. So I just stayed away from it and took my Tylenol and ibuprofen, and I was completely fine. I think a lot contributed to that whole evening of panic for me. And I kind of want to talk a little bit about that because I really want to show that recovery from surgery is not as simple as the physical recovery. For some people who may relate to me, the emotional aspect of it could play a big role too. The whole experience of surgery definitely contributed to my unpleasant experience. And it has nothing to do with the doctor not doing his job correctly, the nurses doing their job incorrectly. It has to do with these unpredictable factors that isn't necessarily anyone's fault. It just was unlucky matchings of those circumstances and things like that. To preface this, when I came back from surgery, that whole evening and nighttime, I was basically having a panic attack for hours. I felt it immediately brewing underneath the surface, but I think the anesthesia was affecting me so intensely that it kind of subdued the panic attack from bubbling up full force, if that makes sense, because you're not really mentally there yet, right? And so I felt it immediately when waking up from anesthesia, but it wasn't until I got home and settled into my area on the couch and was in there for about 2-3 hours where I started to come out of the anesthesia, and then the panic really started to set in. And it hit really hard. I haven't had a panic attack in years. And I manage my anxiety pretty well on a day-to-day basis, even though I do struggle a lot with anxiety. My anxiety is very physical. It's not really mental, I will say. And so I think because of that, it's easier to manage panic attacks because you could kind of control your thoughts more and it's not like you start spiraling, right? But I think sitting there for hours, not being able to breathe out of my nose, feeling that discomfort of the gauze covering this whole portion of my face, I just started to, I know it doesn't sound reasonable. And for those of you out there who've experienced panic attacks or have panic attacks, you'll know that it's not necessarily reasonable, but the feeling and the response you get is just so big and intense. And people will oftentimes describe it as you just feel like you're dying. And that is literally how I felt. I am so lucky that my partner is a nurse, because if he wasn't able to emotionally comfort me, physically comfort me, and on top of it, objectively show me the numbers of my oxygen levels, my heart rate, my blood pressure, and things like that, and objectively explain to me that I am okay, those panic attacks would have escalated to a point where I probably would have forced him to bring me back to the hospital, which was an hour drive away, and they wouldn't have been able to help me even because there wasn't anything they could do. All of this to say, I think a big contributing factor to my panic attacks that night has to do with the woman that was unfortunately placed next to me in the pre-op and post-op room. This isn't anyone's fault. This isn't even her fault. She was an elderly woman. She was probably in her 80s. Judging off of the conversation she was having with her doctors and nurses, she was old enough to not really have anyone in her life. She seemed really out of it even before they medicated her. Before surgery, you're talking to so many people, which is good because you're meeting your team essentially. You're talking to your nurse, you're talking to possibly a nurse assistant, you're talking to your anesthesiologist, you're talking to the anesthesiologist's assistant, you're talking to your doctor that's performing the surgery. When you're ready for surgery and when they're ready for surgery, they wheel you into the room. Usually during that time, it's really scary. So they will give you some sort of anxiety medication of some sort, whether that's a pill or whether that's through your IV, which honestly, that shit is strong because that will, no matter how anxious you are, that will completely take your nerves away. And so they wheel you in as they give you that through your IV. So you're relaxed during it. And then basically they're communicating to you what they're doing the whole time, like, oh, we're about to strap you down, but this is just a precautionary thing, things like that. And before you know it, you're out and you wake up in the post-op room. While I was in that waiting period between talking to my medical team and getting wheeled into my operative room, I was laying there for about 30 minutes or so, just listening to that older woman next to me, constantly screaming at the top of her lungs, help, help. There's something about like an elderly person screaming for help that I don't know like what it does to me. And I don't know if any of you can explain this psychologically or spiritually or whatever, but it like really set me on edge. Like in a very non-reasonable, energetic sense, like to a point where I was like calling my nurse over and saying, that woman is screaming for help. Like, is anyone gonna go check on her? And the nurse was like, you know what, Irene, just worry about yourself. Like that we're gonna take care of our job. Like your job is to just be the patient and lay there. Thank you for worrying about her though. But I was just like so freaking anxious. And so she would scream for help. Her team would go check on her and be like, oh, are you doing okay? And then I would expect the woman to say like, oh, I feel like pain here, or I'm nervous or whatever. But when they would go check on her, she would be like, oh, there's nothing wrong. I'm fine. And that set me more on edge because there's a cognitive dissonance there. I'm already physically dysregulated, but on a cognitive level, I'm like, that doesn't make sense. Why is she screaming and then saying she's okay when someone comes and helps her? The type of person I am, when I start to get really dysregulated and anxious to a point of panic, I notice that the panic comes from dysregulation that can't be resolved because there's no sense to it. And so therefore there can be no resolution. I just had to deal with her indefinitely screaming for help and not getting the help because when nurses would go help her, she would say she doesn't need help. You know what I'm saying? And so that already set me off edge. I thought at the time it doesn't matter because I'm going to go to surgery, come out and be done with her. But little did I know that I would also wake up from surgery with her right next to me and it would be even worse. And that the nerves that I had felt going into surgery because of her was gonna linger in my system in an energetic sense for the rest of the night. So I woke up from surgery very, very groggy. Usually when I wake up from anesthesia, I could barely open my eyes because everything is way too bright. It's really difficult to verbalize. It's really difficult to take in any sort of sensory information. The only sensory thing that was working somewhat properly and wasn't overstimulated was my hearing. I think another aspect of why I had a lot of anxiety and what contributed to the panic attacks was the hospital itself was overstimulating. So my endometriosis surgery experience was actually really, really good. The hospital rooms had a warm, dim light, which made a huge difference. And I remember the post-op room too was even dimmer because it felt like they wanted me to wake up feeling like it was nighttime and feeling like I was ready to go home and rest and sleep for the rest of the night. This hospital experience was not like that. And again, it's not their fault. It's just different environments, different systems. They operate differently and things like that. There was a lot more people. It was a lot louder. The lights were fluorescent and very, very bright, both in the pre-op room and the post-op room. And on top of it, that old lady was next to me and we woke up at the same time. We literally were both on gurneys. She was right across from me. So I could see her when I slightly opened my eyes, but I didn't need to because I could hear her screaming as soon as she woke up. I want to die. I want to die. Now imagine an old, fragile lady screaming that multiple times while you're still like not fully there mentally to process anything logically, and you're kind of just working off of the bare minimum of like senses. That on top of the post-op nurse that I woke up to was at the foot of my bed. He's not doing this on purpose to make me anxious, but because I was already on edge, I was being very overstimulated by every little insignificant thing. So every time I would wake up, I would catch him staring at me literally like this because he had his nursing computer here on the side and then I was right there, right? And so he would be typing things and then keeping his eye on me to see like where my progress was and waking up and things like that so he could get me ready to leave and go home. But just the way he was looking at me through the side of his eyes freaked me out. And I remember after the old lady started screaming for a while, I just couldn't do it anymore because on top of it, I woke up from surgery nauseous, which is something I really didn't want to experience. I remember he had to administer nausea medication to me twice through my IV. That, and I remember I had to ask him to wheel me into another room because I could not handle the screaming that was coming from that older woman. It was making me really, really anxious. And so luckily he wheeled me into another room to continue the waking up process in there. It's almost like when you're in a dream and you're living a nightmare and you're trying to force yourself to lucid dream in the nightmare and force yourself to like gain consciousness in your body to control it. That's what it feels like to wake up from anesthesia and gain control of your body. So I went through that process. He gave me my clothes. I got dressed. He gave me a wheelchair and he started to wheel me out to my partner who had pulled up in the curbside to pick me up. And while the nurse was wheeling me out to the car, there was this really creepy man right outside the door. And I was literally sitting in the wheelchair, so out of it, eyes closed, probably looked like a wreck. And that man had the audacity to sexually harass me. And he was just like, "Hey girl, what are you doing here?" Like gauze on my nose and everything. Like, what is he thinking? But I think that experience was just a cherry on top. It obviously triggered me because I have CPTSD with that kind of stuff due to my sexual trauma. It's very deep-seated. It's something that I work on every single day and still work on and will continue to work on for the rest of my life. That did not feel good. I hadn't been harassed like that in a while, and I think being harassed like that in such a vulnerable state it did not feel good. Something to keep in mind is that while you're planning and considering things, there's only so much you could plan for. To a certain extent, you just have to figure out, is the relief of symptoms going to be worth it to you? And are you willing to go through pain, discomfort, sometimes even emotional distress in order to achieve that symptom relief? Looking back, I wouldn't go through what I went through again, but I'm just glad that I'm out on the other end and I could breathe through my nose. And so let's talk about some positives that came out of this surgery. Ever since getting my splints out, I joke that I could smell in 4D. I joke that I could smell textures. The way that I like to describe the difference between breathing through my nose before surgery and after is, if you guys remember how it feels as kids to take a straw, put it in your mouth and breathe through it, almost like you're imitating those old cartoons where the characters will hide underwater and breathe through a straw, and the straw's on the surface of the water and they're just breathing through that tiny hole. You know how, like, even though you're trying really hard to get air through that straw, you start to suffocate eventually because it's not enough? That's how it felt for me breathing through my nose before the deviated septum was fixed. It's like air does go in there, but it's not enough air, and you feel like you're just slowly suffocating. Like you're getting just enough air to keep your body going, but as soon as you start moving your body more than usual, or doing any sort of physical activity, or you wake up from your sleep, you feel like you're just starting to suffocate. It feels very claustrophobic to not be able to breathe the amount of air that you're supposed to be breathing, and there's obstruction going on, right? So after the surgery and the splints were removed, it feels like the straw was removed and I was able to actually breathe in everything straight through the source. And that is priceless. I genuinely don't know how there's people out there who are just born with normal airways and don't feel endlessly grateful that they could just get all the air they need without even having to think about it or try. You know what I'm saying? Just being able to take an inhale through my nose and actually feel the air going in through that nostril that had the deviated septum. I feel more regulated. I feel more positive. I feel like I could just exist and do things. Of course, there's some things that I can't really divulge here because it's going to take time for me to really understand and keep track of those differences, like how it's going to affect my health long term, how it's going to affect my mental health and emotional health in turn, and things like that. I am going to be getting an even bigger surgery next year, which is a double joint replacement in my jaw and left fort surgery, I think it's called. It's to bring my lower jaw forward to fix the malocclusion. That one is making me really, really nervous. But yeah, I hope this video has been helpful for you guys. If you are going in for a septoplasty surgery soon, I wish you luck. I wish you speedy recovery. You can do this, and I'm so excited for you to be able to breathe through your nose as well. Other than that, thank you guys for watching today's video. If you haven't subscribed already, press the subscribe button down below, and if any of you feel kind enough to give a donation to my channel so that I could keep making videos, go hit that heart thanks button down below as well. But with that being said, I will see you guys on next week's video. Bye.